Ready.
So that's your esophagus that goes into your stomach, into your small intestine and large intestine, and then eventually out from your bottom.
Mm-hmm.
Doctor has a special instrument where he's going to cut, staple, and then completely remove that back section from your belly. And all that he's going to leave left is this banana-shaped belly.
Mm-hmm.
And that's the sleeve.
Mm.
Sleeve, you typically lose about 50 to 60% of what we call your excess body weight.
Mm.
You need to take a multivitamin and a B12, and that's lifelong.
Thank you.
We'll also recommend a calcium with D, but your multi and your B12 are the most important.
Okay.
We are a center of excellence, which means our surgeons are very good at what they do, but even in the best hands, there are some risks.
Mm.
You can have a risk of a leak, which can be about 1 to 2% of patients may experience that, or you can have a risk of some heartburn or reflux. So I'll write GERD is the other name for that.
I've seen people talking about that.
So
I added myself to a few groups.
Yeah, sometimes those can be very helpful. So some studies can say maybe about 5 to 10% of patients may experience reflux, but other studies have shown even more.
Mm-hmm.
Perhaps maybe 30 or 40% of patients may develop reflux. Can you imagine the same amount of pressure that's in a normal stomach now is in a much smaller area, and that's going to cause some heartburn or reflux.
Mm-hmm.
I give all of our patients an anti-reflux medication like Prilosec, and that's going to be one of the medications that I send to your pharmacy. Most of my people are off of it by 6 months to a year.
Mm-hmm.
There are some patients that need to stay on it long term because that's the only thing that can manage their reflux. I'd say the literature talks about maybe 1 to 2% of patients have such horrible reflux that no matter what we do to try to manage their reflux medically, we have to convert them to a gastric bypass because that's the only thing that can manage their reflux. Bypass will improve if not resolve reflux. Okay. A leak, like I said, can occur maybe about 1 to 2% of patients. What I mean by that is that long staple line, typically if it does occur, that top area can open up. Your diaphragm is what separates your chest cavity from your belly cavity. And that leak can occur up there. Okay, and again, maybe 1 to 2%. Sometimes can be a little bit challenging to manage that. Sometimes you need IV nutrition because you can't have anything by mouth. Sometimes a scope will put in to kind of close that area up, like a clip to kind of clip that area up. We try to heal it that way. Okay, make sense?
Yep.
Questions about sleeve versus bypass?
No, thank you.
Make sense?
Yep.